A 52-year-old woman comes to the emergency department due to recurrent right lower extremity swelling, pain, and erythema. Fine. The patient's medical history includes type 2 diabetes mellitus, and yeah, this is a thesis topic of mine. I did a clinical research and published international uh, public. I have several research articles that are international publications on type 2 diabetes mellitus and depression, which have a bi-directional relationship. To know more about it, you can have a look at my LinkedIn profile where I have posted the articles. The medications this woman was taking were metformin, paroxetine, and a multivitamin. Metformin, you all know it is a biguanide, whereas paroxetine is a selective serotonin reuptake inhibitors. Always approach a question stem, whether be it USMLE, NEET, NEXT, or PLAB. Always approach this in this manner. Any exam, medical exam, engineering, always start to identify what all you know. Multivitamin, this we don't know. Let us see further. The patient is diagnosed with cellulitis. Okay, this is the main problem of the person right now. Admitted to the hospital and started on antibiotics. Okay, she is continued on her home medication. 3 days later, the patient becomes agitated and delirious. Okay, delirium, that is a acute confusional state with severe abdominal cramps and diarrhea. Her temperature is, yeah, quite high, 102.6 degrees Fahrenheit, 39.2 degrees centigrade. Blood pressure is also shooting up, yes, 180 by 100, and heart rate is 120, much more than what is expected, but it is regular. Examination patient is diaphoretic. Diaphoresis means sweating, and tremulousness means shaking hands, and her pupils are dilated. Okay. Bilateral hyperreflexia and ankle clonus is present. She begins to have seizures. Okay. Which of the following antibiotics was the patient most likely? First of all, her medication was metformin paroxetine. I am suspecting something on the lines of, yes, you guessed it right, serotonin syndrome. The reason is because paroxetine is a selective serotonin reuptake inhibitor and her symptoms are in tandem with serotonin syndrome. So let us have a look at the diagnosis first. Serotonin syndrome is one which is characterized by a triad of autonomic instability, that is hyperthermia, harm. It causes harm to the patient. Hypertension, autonomic instability, rigidity, myoclonus, all of these things are characterized in serotonin syndrome. Hyperthermia, hypertension, altered mental status, agitation, confusion, delirium, which we are seeing here. Autonomic instability, altered mental status, and neuromuscular hyperactivity. That is tremor, hyperreflexia, myoclonus, which we saw. Fine. So all these three things are present. So the diagnosis is serotonin syndrome. If you reached it by reading the symptoms, congratulations to you. Give yourself a pat on the back. Excellent effort. Now, why does it occur? Gastrointestinal symptoms and diaphoresis also occurs. It occurs due to an increased serotonergic effect in the CNS, that is increase in 5-HT1A and 5-HT2A receptor stimulation. Rarely occurs with a single serotonergic drug used at therapeutic doses. Most commonly it is due to the combined effect of several serotonergic medications, overdose, or a drug-drug interaction. This also is seen more when a monoamine oxidase inhibitor is combined with a serotonergic selective serotonin reuptake inhibitor or serotonin norepinephrine reuptake inhibitors like venlafaxine, duloxetine, all of them. Now, causes I told you, drug interactions also I told you. One drug interaction which is extremely important is serotonergic medication. Any serotonergic medication, like the patient is having paroxetine, which is an SSRI, serotonin medication, and monoamine plus monoamine oxidase inhibitor or Very important, brace yourself, Linezolid. It creates lines on platelets. It leads to thrombocytopenia. It is a drug of choice in vancomycin resistant staph aureus and vancomycin resistant enterococci also. Extremely commonly used and prescribed by clinicians all over the world. So you have to be extremely careful when giving Linezolid because it can lead to serotonin syndrome. Then another serotonergic drugs of abuse can cause ecstasy, also known as MDMA, which stands for methylene dioxymethamphetamine. Methylene dioxymethamphetamine. It is an amphetamine, a drug of abuse. Fine. Then clinical features, which I told you: mental status changes, autonomic dysregulation, neuromuscular hyperactivity. Let us have a look at the options. Okay, clindamycin, doxycycline, linezolid, penicillin. Without doubt, the answer is linezolid. Extremely important drug which you need to know. It is used to treat infections caused by gram-positive bacteria. Particularly, I told you vancomycin resistant enterococcus and Versa and Vari. It has monoamine oxidase inhibitory activity and therefore it can precipitate serotonin syndrome. Now let us talk about other options. We know our answer, but you should know about other options like clindamycin, doxy, penny, and vanco. They do not have choices A, B, D, and D do not have any MAOI, monoamine oxidase effect. Therefore, they do not cause. The educational objective, I told you the triad, what the USMLE is trying to test, triad of autonomic instability, altered mental status, and neuromuscular irritability. Can develop when monoamine oxidase inhibitor antidepressant or non-antidepressant with monoamine oxidase like linezolid is combined with serotonergic medication such as SNRI, tricyclic antidepressant or SSRI. Bye.